Hello everyone, this is Dr. Sushma Sarala, consultant homeopath at Fidicus Homeopathy. Today we are going to discuss about the most misunderstood topic, that is fibroadenoma of breast. So why is it misunderstood? Because it is a tumor occurring in the breast and many people mistake it for breast cancer. So we cannot easily distinguish a breast cancer lump from this fibroadenoma lump just by appearance or feel of it. And also the pain associated with fibroadenoma, the discomfort associated with it, the anxiety issues people face thinking that it is breast cancer, and also the distortion or the difficulty with pain, and also the changes that happen in the breast tissue and changes that happen in the breast shape make it a point of discussion. So let's dive into the topic to know more about fibroadenoma. What is this fibroadenoma? Fibroadenoma is non-cancerous breast tumor which is smooth and rubbery in texture. It is non-cancerous in nature, that is what we have to remember. And also it has other name called mouse in the breast. Why is it called mouse in the breast? We will discuss it later in this topic. What are the signs and symptoms of fibroadenoma? Fibroadenoma is a smooth, round, clear-cut bordered lump. So here we are discussing about the lump features of fibroadenoma. The lump in fibroadenoma is smooth and round and the borders are very clear. It feels like marble whenever you touch the breast tissue and you palpate it. What do you mean by palpating? Is you put the hand on it and press the lump all along. So you will feel marble texture, and also that is smooth texture, and it will move easily under the skin. The reason because it is moving smoothly under the skin and that it is not attached to the breast tissue, there is other name for it, that is mouse under the breast. Sore a few days before your period, that is this fibroadenoma usually occurs in the reproductive age of the woman, that is 14 to 35 is the common age or the most prevalent age for this fibroadenoma. And if you are experiencing fibroadenoma, then you will also experience pain, soreness or tenderness in and around the menstruation phase because of the hormonal fluctuation. It may hurt when it touched. Not all fibroadenomas hurt when touched, only large or giant fibroadenomas which are more than 5 centimeters, especially during the menstruation phase, are sore, tender to touch. Range in sizes. Yes, less than 2 centimeters of fibroadenoma is not to be concerned a lot, but more than 3.5 to 4 centimeters or more than 5 centimeters fibroadenoma is a concern. They grow slowly. They can grow slowly and also they can reside back. That is, if they occur at in and around 35 years of age, during the menopausal age, that is 45 to 55, they can slowly shrink also. If they grow slowly also, during the menopausal age, they can shrink as well, can reduce and are affected by hormones as we already discussed. As you can see in the picture, there is 5 pinpoint presentation of fibroadenoma: lump, swelling, generalized pain, tenderness during menstruation, and also pain in the armpit. Some people experience pain even in the armpit, that is radiating pain. And also greenish or brownish nipple discharge, which is very rare, only occurring in giant fibroadenomas. Now let's get into the investigation part of fibroadenomas. Whenever you feel that there is a lump inside your breast, the first thing you should do is get doctor consultation. When you have a doctor consultation, the doctor will feel the breast, they will palpate the breast, they will feel the surroundings of the breast, they will feel the texture of it and how it is. Next, coming to the imaging test, they will advise you for some imaging tests. Here, USG is done as a primary test for fibroadenoma. What is USG? That is ultrasonography for the breast, where it uses the sound waves to know about what is inside of the breast tissue, or that is what is inside of the lump, what is the size and what is its shape. And then to know about the margins of the fibroadenoma, we will be doing a mammography, where the clearer the margins are, the clearer the picture of the fibroadenoma is. And if it is not distinguishable, or if there is any problem of the inside of the lump, if the tissue inside of the lump is of different consistency, then the doctor will advise you for a biopsy. Here we can distinguish if it is cancerous or non-cancerous. As you can see in the picture, this is the ultrasound of the fibroadenoma. You can see this clear lump, and also you can see the shape and size of it much more clearly. And here we can see the mammography report. Here we can see the borders of the fibroadenoma much more clearly. Now let's get into the structure and function of the breast. First we will know the anatomy, that is what is the breast made up of, and the physiology, that is what is the function of the breast, so that we will understand what changes happen to it in fibroadenoma. As you can see in the picture, this is the cross section of the breast. That is, if the breast is like this, it is cut into half and then we are viewing it like this. So here you can see this is the nipple and here this is the breast tissue. These are the lobes and the inside circles are called as lobules. Okay, and all of these lobules are connected through duct system, and this duct system is connected to the nipples. So this is the basic anatomy or basic picture. We have lobes arranged in the form of a flower inside the breast, and in this lobes we will be having lobules, and these lobules are connected to ducts, and these ducts are directly connected, or these ducts form into a system which are connected to the nipple. So what is this duct system doing and what are these lobules doing? All of this help in milk production. They are very much responding to the estrogen and progesterone levels in your blood. So whenever there is increase in these hormones, the breast tissue proliferates, that is, it increases in size, and also the milk production happens, and this milk from here, it is collected through the ducts and it will be ejected through the nipple after delivery for the baby. Next, let us get into the risk factors for fibroadenoma. The primary risk factor for fibroadenoma is age. Age. 14 to 35-year-old people, women of reproductive age, are more prone to fibroadenoma. As we already discussed in the structure and function, that the breast tissue is respondent to estrogen and progesterone and other female hormones. So because of this, especially people in the reproductive age, because of the hormonal fluctuation, this fibroadenoma can occur and also grow in size or decrease during the menopausal stage. So age is an important factor. Hormones. So people who are taking oral contraceptives before the age of 20 can have a greater risk of fibroadenoma compared to other general population. Race. People who are in African continents or the Asian people are more prone to fibroadenoma rather than other people. Genetics. If your mother or your grandmother is suffering or has suffered from fibroadenoma, the risk of you suffering slightly increases. Now let's get into the causes, or what is the cause for fibroadenoma. As we can see, hormonal etiology theory, it is just a theory. There is no pinpoint cause that, or a cause that we can point out to telling that this is the thing that is causing the fibroadenoma. So we just have a theory which is proposed by scientists, which is the hormonal etiology theory. That means people who are taking a lot of contraceptives before the age of 20 or excess exposure to estrogen or hormonal pills can trigger fibroadenoma because the breast tissue is susceptible to these hormonal changes. We do not have any particular cause to this disease. Next, coming into the body changes. So what happens in the breast tissue when we have or when there is development of this fibroadenoma? Let us know about the points of this body changes. First thing is the intracanalicular and pericanalicular growth patterns and also the biphagic growth patterns. First, let us know in detail what happens in the starting and then we will discuss about the growth pattern. As you can see in the picture, this is the breast tissue and these things are the lobes and inside them we have lobules. So what I have drawn here is the terminal duct. And from the terminal duct we have these lobules and all of these are in the lobe. Okay, so here there is tissue in between these lobules. This is called as interlobular tissue or interlobular stromal tissue, and there is tissue surrounding these lobules which is called intra. So this any problem within the intrastromal tissue or the intrastromal tissue surrounding the lobules, we have two diseases. One is fibroadenoma, the second one is called as phylloid tumor. Any changes occurring in the intrastromal tissue can lead into two diseases, fibroadenoma and phylloid tumor. But what happens in fibroadenoma is that this tissue, there is increase in this tissue due to estrogen hormone. especially girls who are taking oral contraceptives, especially below the age of 20, or who have started taking oral contraceptives at their teenage age and they are continuing, or taking a lot of oral contraceptives. These people can start seeing changes in the intrastromal tissue, where there is increased in the breast tissue and also the connective tissue of the breast. This will cause for the formation of a lump. These are the changes that is happening in the body. And when you cut this lump and see when you cut this lump and see and put it on a plate, you will see that there are nodes in this, and the nodes are bulging out. That means the lump is so tightly wound that whenever you cut open it, they will bulge out. So this is the gross morphology of that lump. And also, if you see the lump directly like this, there will be slit like spaces. That is, if this is the lump and you're seeing it like this, there will be slit like spaces inside the lump. This is also the characteristic feature of fibroadenoma. Now, what is this intracanalicular and pericanalicular? Just remember that the intracanalicular, the pericanalicular, when you observe under the microscope, if there are slits, that is compressed, no space, no lumen. Lumen is called as space. If there is no space, that is no lumen, then that is called as intracanalicular. If there is space, if there is hole, or if there is space, then that is called as pericanalicular type of fibroadenoma. It is one of the growth patterns. Next, what are the key features of it? Biphasic, well-defined borders, bland nuclei, and low mitotic rate. This is something to deal with the histology. That is, when you observe a breast tissue, take a part of it and observe under the microscope, you will find that there are bland nuclei and low mitotic rate. What is low mitotic rate? Mitosis is division. So the mitotic rate is very low. That is why it is a slow growing tumor. Biphasic means two different types, stromal and epithelial cells are involved. Well-defined borders are the characteristic feature of this fibroadenoma. Remember, if the borders are fine or if the borders are margined and they are proper, then that is a characteristic feature of this fibroadenoma. If the borders are not proper, or if you cannot diagnose or determine the proper borders of it, it can be breast cancer. Now let us know about the types of fibroadenoma. First one is simple fibroadenoma. Simple fibroadenomas are less than 2 centimeters in size. They do not cause any dysmorphic changes, that is no change in the breast tissue shape of the breast tissue, and also not much pain associated with it. Complex fibroadenomas. Complex fibroadenomas are adenomas which occur after the age of 35. They can cause a little bit of pain, and if you see under the USG or in the mammography report, the simple one, if you see under the USG report, you will see that simple one will have normal morphology, but in the complex one, we can see small calcifications or small cysts. What are calcification? Deposition of calcium inside the tissue is called as calcification. You can see that in complex ones. And there is slight chance of this complex tissue, which is less than 3 centimeters, turning into breast cancer. It occurs after the age of 35. Then coming to the giant fibroadenoma. Giant fibroadenoma usually occurs in pregnancy or in lactating women, and it is 5 centimeters in size. And then we have juvenile fibroadenoma. As we have already discussed, people who are starting their oral contraceptives at a very young age, like at 14 or during after the first menarche itself, they are starting their oral contraceptive, then they can develop the juvenile fibroadenoma, but the causes of it are not strong. That is, only people who are taking oral contraceptives will have fibroadenoma. We don't know about that clearly. But people who are taking oral contraceptives are more prone. So this juvenile fibroadenoma occurs in the teenage and is usually small, that is less than 2 centimeters. But remember, it has one characteristic. This juvenile fibroadenoma can grow very fastly compared to the other forms of fibroadenoma. So if you are suffering from juvenile fibroadenoma, you should get your breast checked every 3 to 6 months. Next, coming into the myxoid type of fibroadenoma. This myxoid type of fibroadenoma occurs because of a mutation in the gene. Now coming into the conventional part of fibroadenoma. If you are experiencing fibroadenoma or suffering from fibroadenoma and you have gone to a gynecologist, then what do they suggest? The conventional treatment, that is the allopathy or Western way of treating a disease. First thing is observational. Remember, if the fibroadenoma is less than 2 centimeters, then the gynecologist or your doctor will ask you to come for regular checkups, that is every 3 to 6 months, so that they can monitor if there is any difference in the margin size or size, shape, and also inside texture. Then they can send you for a biopsy. But less than 2 centimeters, there is no certain therapy required for fibroadenoma. Here, observational less than 2 centimeters, any doctor will advise you to come for regular checkups, that is for every 3 to 6 months. They will see if it is growing in size, shape, or any consistency is improper. Then they will only advise you for a biopsy. Minimal invasive procedures like cryoablation and radiofrequency ablation, which is freezing of the tissue or heating of the tissue to destroy that or to make it small, is called cryoablation and radiofrequency ablation. The problem with it is that there will be harm even to the surrounding healthy breast tissue, and not only that, there can be side effects like bleeding, redness, and severe pain associated with it, and also infections. If the size is more than 5 centimeters, they will be asking for a lumpectomy, that is taking out of the lump of the breast tissue which has been affected by fibroadenoma. And also hormonal management, which is seen in very less amount of cases if there is increased recurrence, but it is not usually advised. So what is the problem in all of this conventional treatment or this allopathy or Western form of treatment is that they are not addressing the cause of the disease. And also, if there is lump in one of the tissue, that is if there is lump in the right breast, they have taken out the lump, there is every chance that you can get another lump in another tissue, that is another side, this is left side of the breast, or you can develop another lump again in the right side also. So treating the cause and addressing the genetic factors and also taking the holistic case will help in better management of fibroadenoma. Now coming into the homeopathic treatment part. So why do you have to take homeopathic treatment for fibroadenoma? First one, it is safe. So you do not have to worry about the side effects of it. It is timely. It is not that you take homeopathic medicine and then the next day you are free of fibroadenoma, because if it is developed slowly, it will also decrease slowly in a timely manner. There are no side effects, there are no hormonal pills, there are no steroids, and also if the fibroadenoma is in a manageable size, then we can take homeopathic treatment, which will help in decreasing the size of the fibroadenoma, the pain and the discomfort associated with it, and also if there are any hormonal dysfunction or disruption due to any other diseases also, that can also be corrected. And holistically, the medicine will help you in giving a better health. It helps in preventing recurrences, and also it helps in curing the present case and also relieving the symptoms. Now let us get into the precautionary part. Remember, the precautions are very important for fibroadenoma. Let us know what they are. First, maintaining a healthy lifestyle. Improper lifestyle or improper sleep pattern, improper diet, no exercise, stressful life can lead into hormonal fluctuation, which can cause us fibroadenoma. So maintaining a healthy lifestyle is very important. And the other important one is performing self breast examinations. As you can see here, once a month, 2 to 3 days after the period, every woman who is in their reproductive age or experiencing the perimenopausal stage, which is before the menopause, should always examine her breast. Even people who are experiencing the menopause should also examine the breast for other breast diseases. So examination of the breast and the armpit is also required, and also using fingertips with massage oil or shower gel. Do not directly press on the breast tissue, but apply some oil on your hand and also on the breast tissue and also on the armpits for a smoother examination. Start by examining up and down the breast, then wedges, that is in circular motion. Try examining the breast. Try examining the breast using a mirror also. If there is any decrease or increase in the size and shape of the breast, that can be examined by seeing in a mirror. And also changes in skin color. If the skin color changes from your normal skin tone to reddish or orange peel appearance. That is, as you know, everybody has seen an orange, right? So if you know how the orange peel is, it is slightly orangish in color, and it has a small indentations or small holes on it. If there is that appearance, that is called as orange peel appearance. If there is orange peel appearance of the breast, then you should get a doctor consultation as soon as possible. If there is any discharge from the nipple, it can be bloody discharge, it can be yellowish color discharge or milk discharge, even if you're not lactating. All of these discharges from the nipple should be examined by the doctor also. And any nipple deformation, that is, if the nipple is distorted, that is, it is fixed in one direction, it is not looking healthy, and it is retracted, then that also should have a then that also should get a doctor consultation as soon as possible. So by doing all of this breast examinations, you will know how healthy your breast is. After breast examination, make sure if you're having a family history of fibroadenoma, make sure that you get a doctor consultation every 1 year. And then avoid unnecessary hormonal treatments. If you're experiencing fibroadenoma or if you have a family history, try avoiding hormonal therapies. Coming to the consultation part here at Fidicus Homeopathy. If you're suffering from fibroadenoma and you're looking for a proper treatment, here at Fidicus we are offering you with two types of online consultation and offline consultation. In online consultation, we are giving you with audio and video consultation options. If you have any sort of doubts or if you are having some investigations, lab investigations, you can share it with us, and if you need further more investigations, we will ask you for it. After doctor consultation, the medicines will be directly delivered to your home. If you are staying in India, then it can take 3 to 4 business days. If you are staying in USA, it can take 3 to 5 business days. Anywhere else, it can take 4 to 8 business days for our medicines to reach your doorstep. If you are staying near the nearest branch of Fidicus, you can come and consult us in person. If you want to get in touch with us, you can contact us through this number. You can WhatsApp us, message us, or call us on this number. To know more about Fidicus Homeopathy, you can check out our website www.fidicus.com. If you are suffering from fibroadenoma, you are looking for a proper treatment, why should you choose Fidicus Homeopathy? The reason being that Fidicus Homeopathy is the highest chance of health. Here we follow 3 principles. First is already treating the fibroadenoma cases with high success rate. The treatment options here are good with transparency. That means there is no gray area between the patient and the doctor. And also the personal care that we give here. Any sort of doubts or queries or myths that you have regarding your disease will be cleared, and also we will advise you on a better lifestyle. If you're suffering from fibroadenoma and you're looking for a proper treatment, why should you opt for Fidicus Homeopathy? Fidicus Homeopathy stands for highest chance of success. Here we follow 3 principles. Of the already treated fibroadenoma cases, we are having high success rates, and also the transparency in treatment. There is no gray area between the patient and the doctor. We will be telling you about your prognosis and what your case is to you. And also the personal care here at Fidicus is top notch. Any queries, any myths or any problems associated with your disease will be cleared out to you. If you are looking for a proper cure, try opting for Fidicus Homeopathy. Thank you.